The digestive system is responsible for breaking down food and putting it into a form that can be used by the body. Any problem that interferes with the body's use of food can cause a deficiency of nutrients. This deficiency of nutrients is known as malnutrition. Hi, I'm Kathy Getrust, and today's topic is on problems that can interfere with nutrition. There are multiple problems that can interfere with nutrition. First I'd like to mention is a lack of appetite. The medical term for lack of appetite is called anorexia. Many of you are familiar with that term, and there are many causes. First might be loneliness or depression. Our eating is a social event, and I'm sure you've experienced, as I have, that if I'm by myself, I don't eat nearly as much as I do if I'm with a group of people. So it does have an impact on our appetites. Another problem that can interfere with nutrition is the use of certain medications. Recently, I have taken care of a patient who was placed on Adderall. Adderall is a stimulant medication used for attention deficit disorder. And she went from 111 pounds to 85 pounds while taking Adderall in the course of about 2 months. It was necessary for the medication to be stopped because it was having such a negative impact on her nutrition. Illness is another thing that can cause appetite problems. One thing particularly is cancer. People with cancerous tumors that are taking more and more energy away from the body cause an appetite to be diminished. Immobility is another factor. People who have a very sedentary lifestyle that spend the majority of their time sitting in a wheelchair or lying in bed certainly are not going to be consuming the calories or have the energy requirements as someone that doesn't, and lots of times that shows up with a lack of appetite. Another problem is an individual's refusal to eat. The refusal to eat may be for reasons other than that they just don't have an appetite. It could be that they have problems with their teeth or dentures. Teeth might be very poorly taken care of, or they have dental caries, decay that are causing pain and swelling in the mouth. And illness, as most of you know, can be accompanied by a weight loss. When people have dentures and there's weight loss, it causes the dentures to be ill-fitting and can cause irritation in the gum tissue, and as a result they may refuse to eat. Might be that their foods are against their belief system. There are religious belief systems that prohibit certain kinds of foods to be eaten, and you're probably aware, for an example, of the Jewish faith won't eat anything of a pork nature, pork products, bacon, ham, any of those things are against their belief system. So if they're provided that, they're not going to be willing to eat it. Also, people who are vegetarians are not willing to eat any kind of meat product, even if it's broth that has been made from a beef broth or chicken broth, anything like that in soups will be items that will be unwilling to be eaten. Another might be that food may not look very appetizing. It might be that food that is supposed to be served hot is now cold. And you know what that's like to try to eat soup that's supposed to be hot, but it isn't, or potatoes or any other food. It's not very appetizing. Another thing might be the texture of the food. Maybe due to certain illnesses, people need to have their food blenderized, and pureed, blenderized food can look rather unappetizing. Nausea is another problem that people experience that can interfere with nutrition. Nausea, as we've probably all experienced, is that feeling of a need to throw up. It's a queasy feeling in the stomach that might be accompanied with retching or dry heaves. Retching is the involuntary attempt to vomit. It frequently will precede vomiting, or it might follow vomiting when there's no longer any food or liquid in the stomach. But it does have an impact, a negative impact on someone's interest in food. Vomiting is another problem. The medical term for vomiting is called emesis. It might be forceful, and the emesis might even be projectile. Projectile means that the vomit would project past the body. Important to note the color of the vomit, if there's any blood in it, and whether or not there might be any medications, if it's digested food or non-digested, the amount of vomit. If there's a very large amount, certainly the person may have to have some supplements to make up for the fluid that has been lost. Important also to report when this has occurred, if there's any pattern, if there's a particular time of day that this seems to be occurring, and the frequency. If it's once or if it's multiple times, you'd want to be sure to alert the nurse. Another problem is called gastroesophageal reflux disease. That's a really big term, and because of that, it's more commonly just referred to as GERD. The symptoms of GERD are heartburn, a sour taste in the mouth or throat, and it's caused by acid that escapes from the stomach and goes up into the esophagus and throat and causes that sour taste. Smoking, caffeine, and alcohol increase the level of acid in the stomach, causing even more heartburn. The treatment components for GERD include the avoidance of carbonated beverages or alcoholic beverages or other items that make the problem worse. And following a meal, these folks are kept in an upright position for at least 30 minutes after they've eaten, and that helps minimize the problem. Also, they usually sleep with their head elevated, and by avoiding tight-fitting clothes, there is less pressure that's placed on the stomach area, and that helps minimize the problems. Usually, people that have GERD have a weight problem, and so losing excessive weight can often help in relieving the symptoms as well. Eating 5 to 6 small meals works better for them than 3 large meals. And ultimately, they may need to have medication to get some relief and surgery to remedy the problem. Gastritis and ulcers are other problems that interfere with nutrition. Gastritis is inflammation of the stomach lining, and ulcers are actually a breakdown in the lining of the stomach. There are multiple causes for that, stress being a real big factor. Could be bacteria or viruses also are a cause for gastritis and ulcers, as well as overindulgence in alcoholic beverages. Symptoms of someone with gastritis or ulcers might be nausea and vomiting, abdominal pain, heartburn, gas or belching, and blood that appears in the vomit or in the stool. Treatment for this is a special medication. Person might be placed on a special diet, particularly a bland diet that might be more tolerated. Ultimately, they may need to have surgery as well. Visual impairments is another big problem why people may not eat adequately. It's more a problem with the elderly that have visual impairments or are blind due to glaucoma, cataracts, or macular degeneration. When dealing with people who have limited sight, it's important to tell them what they're eating and what's on their tray. Explain things to them, the position of the food on the tray. For example, your coffee is at the upper right corner of your tray and the milk is at the upper left corner. Describe the food on the plate in terms of a clock face. For example, your peas are at 4 o'clock and the chicken is at 8 o'clock. This helps patients be able to eat independently, and as much as someone can do for themselves, the better, as it does positively impact their feelings of self-confidence. Difficulty swallowing is another problem that interferes with nutrition. This is called dysphagia, the medical term for difficulty swallowing. It's not a disease, but it's a symptom of a condition that affects the swallowing process. Some of the common causes for dysphagia are diseases that affect the muscles and nerves. A couple of examples that come to mind are Parkinson's disease or multiple sclerosis. People with those two diseases tend to have some swallowing problems. People with respiratory problems or breathing problems, such as chronic obstructive lung disease, that are really struggling for air, may have an accompanying swallowing problem. And those that have dental problems is another common cause for swallowing problems. Foods that are particularly difficult for them to swallow are foods that are sticky. An example might be mashed potatoes. Foods that are thin, like water or juices, and dry foods such as crackers and toast cause people with swallowing problems particular concern. Warning signs that you want to watch for with these folks that there might be a swallowing problem would be coughing before, during, or after they're swallowing. The need to swallow repeatedly, sometimes 3 or 4 times with each spoonful of food. Frequent throat clearing is another indication that there might be a problem with swallowing. A hoarse, wet, or gurgly breathing. Drooling from the mouth when they're eating. And pocketing of food in the mouth is another warning sign of swallowing problems. Aspiration is the medical term that means taking food, fluid, or mucus into the lungs. This happens when patients swallow these items and it goes into the lungs rather than into the stomach. It's a very serious health problem because it can cause pneumonia or other respiratory problems. When you think that the lung tissue is only to have air in it, that when food or fluid get into it, it's going to set up a situation where there is inflammation and infection that's caused as a result of it. Interventions that will help prevent aspiration is the need for a nutrition support team. This nutrition support team is comprised of a physician, a nurse, a dietitian, and a speech pathologist. And they develop a plan, and this plan helps the patient so that the swallowing problem is minimized. There are special instructions then that are posted either above the patient's bed or in a binder for everyone's use. It's also important to use something that's called a food thickener. Food thickeners are needed to make very watery liquids a little bit more solid. I have an example of a product here that's used for thickening liquids. This particular product is called Thicket, and I want you to see what happens when I just add a teaspoon of this Thicket to this orange juice. By stirring it briskly, you may be able to note that it's getting thicker, and it changes the consistency from a very liquid orange juice to something that is more of a nectar consistency. There are 3 different kinds of consistencies that people will, that this nutrition support team will work for. The instructions might be that it should be of a nectar consistency, and that's a little bit thicker than water, for example. I'll pour a little bit of this nectar, and you may be able to tell it's a little bit thicker than water. it's more like a vegetable juice might be. Another consistency of the liquids that might be prescribed in the instructions would be of honey consistency. And as I pour honey, you can see this is even a little bit thicker than that nectar consistency. And then the third consistency that might be prescribed would be a pudding consistency, and you can see that that is the thickest consistency of these three items. And so again, it's extremely important that you follow the instructions that have been provided by the nutrition support team so that the person with the swallowing problem, dysphagia, can make certain that they are not going to have aspiration. When they are being fed, they should be in an upright position. Sometimes they say bolt upright. That means really straight in a 90-degree angle. But it does help them so that they do not have that aspiration problem. Then they remain in an upright position for at least 30 minutes after the meal. Encourage to have them tuck their chin when they're swallowing. Tucking the chin can help swallowing so that it goes into the stomach as opposed to into the lungs. Alternate liquids and solids so that you're not giving all the same thing ongoingly. Encourage them to swallow a second time to be certain that the food that has been placed in their mouth has been swallowed. And encourage them to eat slowly. This is not a time for a lot of conversation. These folks have to work very hard at trying to swallow and keep food from going into the lungs. So limit your conversation and have them eat slowly. Keep the amount small. Only about a half a teaspoonful should ever be presented into their mouth at any given time. Watch for pocketing of food in the mouth, and do not give them any more food if you notice that they have a large amount of food that's still in their mouth, or they should completely empty their mouth before you present them with more food. The orders from the nutrition support team might also say that they may not use any straws. So watch for the instructions because they are individualized for each patient. Now I'd like you to watch a demonstration of feeding a patient with dysphagia. Feeding a patient with dysphagia. Wash your hands. Prepare the patient for mealtime. Position in a bolt upright position with feet flat on the floor. Use pillows if needed to maintain an upright position. Obtain the meal tray and check for completeness. Check the diet card with the patient's identification bracelet. Check any special instructions for feeding this patient with dysphagia. Assist in food preparation. Add thickener to liquids as needed. Do not use straws. Place food on the tongue with a spoon filled half full. Have the patient tuck her chin about 45 degrees. It will help to prevent aspiration. If the patient is paralyzed on one side of the body, feed on the other side of the mouth that's not paralyzed. Encourage to swallow twice after each bite. Watch the Adam's apple rising and falling as an indication of swallowing. Do not rush. Allow the patient to set the pace for eating. Provide verbal cues to remind the patient to open, chew, and swallow. Avoid distractions. The patient must concentrate to swallow. Check that no food has been pocketed in the mouth and is completely empty after feeding is completed. Complete the follow-up tasks after feeding. Keep the patient in an upright position for 30 minutes or as directed after eating. Wash your hands. Now that you've seen that demonstration on feeding a patient with dysphagia, I'd like to talk to you about some assistive devices that are used. These are special feeding utensils that are designed to help patients perform tasks that they ordinarily otherwise would not be able to. These items are usually needed for patients that have had a stroke, for example, where there has been paralysis or weakness on one whole side of the body. Or it might be for someone with rheumatoid arthritis where they have a lot of swelling and stiffness in their joints, particularly of their hands, because that's what we're talking about in this discussion about the need to be able to feed themselves. There are a lot of different types of assistive devices, and I've just brought a sampling of them for you to be able to see. The first one is an Easy Grip cup. You can see that this would be easier to hold on to than a coffee cup that has a little handle for the person who has maybe weakened muscles or a very stiff hurting joint to be able to hold on to. So that's one item that you might see. Another would be built-up utensils. And you can see that the handles have been built up so that the individual who may not be able to hold on in a pincher fashion to these utensils can grab on in a little bit more coarse way to be able to get food items. And they come on all of the different knife, fork, and spoon for the individual's use. Another item is called a food guard. Sometimes people can only use one hand to feed themselves. The other hand might be paralyzed, and so by placing food on the plate, they are able to scoop the food over up to the edge of the guard and then get it up to their mouths and be able to handle it with just one hand. The other item that I have to show is a food grip, or a plate grip, I should say. This plate grip goes underneath a plate and helps keep the plate stationary. So again, if the person is just using one hand, the plate is not going to be moving all around the table for them. It will be staying locked in one stable position. An occupational therapist is a consultant in your health care settings who will evaluate patients for use of different assistive devices. And it's important because it takes time and effort for patients to be trained in the use of these things, but it does help them be much more independent than otherwise they may be. So be patient with them and encourage them to use the devices because in time they will become quite proficient at them. You have a key role as a caregiver. Some of your responsibilities are to honor patients' requests for food preferences and substitute when you can. If a person is not eating a vegetable, it may not be that they just aren't hungry. It may be that they don't like that particular thing. Cooked cabbage, spinach are items that are not real crowd pleasers, so trying to get something else that might be more palatable, like carrots or peas, encourage them to try something else that you'd be willing to find a substitute. Always follow the patient's special instructions to be certain that you're not giving them something that could do them harm, particularly, again, if they have swallowing difficulties. Use the ordered thickeners consistently That means anytime someone with a swallowing problem is going to have a liquid put into their mouth, you would need to use the thickener. That would be when they're getting their medications and need to have a liquid to drink with the medications. A thickener would be needed. If they're going to be brushing their teeth, you would need to add thickener to any water that goes into their mouth as well. Provide for a pleasant atmosphere. That goes a long way for the individual being able to eat better. Provide encouragement to eat and give them praise and physical contact. Research has been done lately that has shown that when physical contact in the form of just patting their forearm, for example, or giving them verbal praise, those folks tended to eat quite a bit more than those that they didn't do that for. So by giving them encouragement, by saying, "Mrs. Smith, you did such a good job of eating today. Good job," goes a long way for encouraging them to eat. Never force a person to finish everything on their plate, however. The Clean Plate Club rule that you may have grown up with does not apply in a healthcare setting. Make sure glasses and hearing aids are on so that they can see what they're eating and that they can hear these words of encouragement. Also, take time. I think that's probably the most important thing. Allow patients to taste, chew, and swallow their foods. This is the highlight of many of the clients' day. So give them time to savor this experience. Some patients in the past, and probably still in the present, receive pureed foods not because they need them, but because they're slow. It's easier to give someone a pureed item such as mashed meats and vegetables than it would be to give them a salad, for example. But it is never appropriate to alter a patient's diet unless they need it for some particular reason, just for our convenience. So be certain that it never, ever happens. And in the past, it has been my experience that on occasion, some caregivers have taken a syringe such as this. This is a 50 cc syringe, have taken the plunger out of the syringe and have put food in it that has been blenderized and put in liquid form. And then they put the plunger back in after the liquid food has been placed in it and have forced the person to eat the food in that manner. That certainly is disrespectful and does not show any dignity for the individual and never would be tolerated. And hopefully never is tolerated in today's healthcare settings. If you would ever see that happen, make certain that you report that to the nurse. Things to report to the nurse: any problems with teeth or dentures so that a dentist can be contacted and the problem remedied. Be sure to report any coughing or excessive swallowing, drooling, or any other signs of dysphagia. Report pain. If patients are having pain, chronic pain, the nurse can give them something for it at 30-45 minutes prior to mealtime so that by the time their tray arrives, they can be much more comfortable and more likely to eat. Report any nausea or vomiting or any heartburn. And finally, report any poor appetite that the patient might be experiencing. As caregivers, we must all do what we can to help patients receive the nutrition that they need when they're recovering from an illness and for living a very healthy, happy life.